Hello friends, welcome to Jellyfish Nursing channel. Today let's learn mental health nursing questions and paper. Okay. So first question, a nurse provide instruction to a client taking fluoxetine, a selective serotonin reuptake inhibitors, antidepressant. The nurse tell the client to take the medication A early in the morning, B at snack time, C during lunchtime, and D at bedtime. So what is the correct answer? A. That is a early in the morning. Why? Because it won't be disturb the sleep. So that is why. A client with depression who has been taking amitriptyline for 3 months returned to the clinic for follow-up. The nurse observed the client in which of the following symptoms? So A. Suicidal thoughts, B. Lack of energy, C. Loss of interest in personal appearance, D. Neglect of responsibilities. So can you see the question? Client with depression who has been taking amitriptyline. So that means they are taking the drugs test, and so the person is having depression, they are taking antidepressant drugs. So what is the correct answer? That is suicidal thoughts, because other lack of energy, loss of interest, neglect of responsibility, these all three things are depression symptoms. So only the correct answer is suicidal thoughts. Okay, next question. A client is prescribed with sertraline to guarantee a safe administration of the medication. Nurse would administer the dose A as needed only for depression, B early in the morning, C taken on empty stomach, D at bedtime. So what is the correct answer will be at bedtime. So why? Because the serotonin is one of the antidepressant. If you are giving in the morning and evening, so it will disturbs the what is the other effect and also making drowsiness. So that is why you have to give the drugs at bedtime. So the correct answer is bedtime only, because it will make drowsiness. Next question. A client arrives in the emergency room with a tricyclic antidepressant overdose. Which of the following measures should the nurse do except? So A. Obtain on ECG, that is electrocardiogram. B. Gastric lavage with activated coracal. C. Administration of sodium bicarbonate. And D. Administration of antibiotic. So can you see the question? They are given tricyclic antidepressant. So what is the question here? Which of the following measures should the nurse do except? Answer is they are asking the except. They should not do the work. ECG, gastric lavage, sodium bicarbonate is a anti-depression, that is we are going to give the drug. Okay, so correct answer is except administration of antibiotic is a correct answer. Okay, because other things are antidepressant overdose. So correct answer is antibiotic. Okay, next. A newly admitted client has started taking bupropion. The nurse monitored which of the following side effect that would indicate an overdose of the medications. So the drug is valproate, that is they are taking. So A headache, B dizziness, C seizure, and D constipation. What is the correct answer? What is the correct answer? Can you guess? Seizure. Why means it is one warfarin is an antidepressant drug. If you are taking that, so what will be the cause? It is most probably you will be getting the what is the seizure will be happen in the side effect overdose. So that is a correct answer. Next question. A nurse is giving discharge instruction to a client who is prescribed with isocarboxyl morphiline. The nurse will tell the client to anticipate which of the following side effect of this medications. A. Weight loss, B. Fever, C. Dizziness, D. Dry skin. So you guess it, which is the most correct answers will be weight loss, fever, and dry skin. It won't be because they have to tell. So the correct answer is dittiness is the correct answer of the what is that Morplan because it will a side effect. Next question. A client with depression is taking phenylephrine. The nurse advised the client to avoid consuming which food while taking the medications. The drug is phenylephrine. So that is Nordil. So what is the food should not take? That is yogurt because phenylephrine is a MAO, that is monoamine oxidase inhibitor. The client should avoid eating tyramide rich food. So that's why you should avoid the yogurt. Okay, got it now? Not only yogurt, even for meat, fruits, and even cheese, some alcoholic beverages and chocolate should be avoided during MAO drug test. Okay, fine. Next. Patient taking MAOI have the tendency to experience hypertensive crisis, especially during an interaction with other drugs such as epinephrine. So, which of the following is sign of hypertensive crisis? They are asking. So, they are given that answer that is crisis. Okay. So, A. Hair loss, B. Orthostatic hypotension, and C. Diplopia. D. Delay in ejaculation. You just think of it hair loss, orthostatic hypotension, delay in ejaculation, diplopia. So correct answer will be the diplopia. Okay, fine. Next, because it will make dilated people, so they can't able to concentrate the vision. So that is why you will get diplopia. Okay. Next question. During a hypertensive crisis, the nurse makes sure which of this medicine is readily available. Okay, which of the drug is readily available? A. Phenethylamine, B. Phenobarbital sodium, C. Diazepam, D. Lithium statase. So, what is the antihypertensive crisis means? You know the drug that will be the phenethylamine. That is a drug of choice they are given to. What is that? Whenever the hypertension crisis is coming, you have to be what is that? Lower the BP level. So hypotension you should bring out. So that is why we are giving phenethylamine mesylate. Otherwise, organ is going to be damaged. Next question. A nurse is giving discharge instruction to a client who will be taking phenobarbital luminol. The nurse would educate the client which of the following that directly correlate with safety of the client. So first, A. Take the medication at the same time each day. B. Take the medication with meals only. C. Avoid using sleep aids while taking the medication. D. Decrease the dosage once with symptom of dizziness and lightheadedness. So the correct answer is what is that? C. Avoid using sleep aid while taking the medication because it is a dizziness will happen, drowsiness will be there. So they have to take along with some what is sleep aid it is. Next, a client who has been taking buspiran for 2 months returned to the client for a follow-up. The nurse determined that the medication is effective if there is an absent display of A. Alcohol withdrawal symptom, B. Paranoid and suicidal thought process, C. Thought causing or delusion, D. Feeling of panic, fear, uneasiness. The what is the questions they are given? Buspiran for 2 months. So the correct answer is feeling of panic, fear, and uneasiness. That will be the correct answer. Next question. Which of the following medication that treat Alzheimer's disease causes slowing of the heart rate and fainting episodes? So you are taking Alzheimer's disease, that means what will be there? So what is the answer? A. Dacrine, B. Galantamine, and C. Donepezil, and D. All of the above. Which drug you will be administered? So you will take all of the above to prevent and slow the heart rate and fainting episodes. Okay, fine. Next question. Methylphenidate is prescribed to 8-year-old child. How many years old? 8 year. For the treatment of attention deficit hyperactivity disorder ADHD, the nurse will last the nurse will most likely monitor which of the following during the medications therapy. So first A, temperature and breath sound, and B, deep dendron reflex, and C, intake and output, and D, height and weight. So what will be the correct answer? Height and weight. Why height and weight it is coming? Because this methylphenidate, it will slow the growth. That means 8-year-old child, the growth is going to be decreased. So that is why you should monitor the height and weight for the person with methylphenidate. Okay, that is the correct answer is height and weight. You got it, I think so. Next question. A client with schizophrenia has been started on medication therapy with clozapine, that is clozaril. The nurse assesses the result of which laboratory study to monitor for adverse effect related to this medications. So the drug is clozaril, that is clozapine they are taking for schizophrenia. Okay. A, random blood sugar, and B, liver function studies, C, platelet count, and D, white blood cells. So what will be the correct answer? Have you guesses? Okay, can you guess that? White blood cells. Because this clozapine, what will happen that agranulocytosis. So what happened that? So that is why you should monitor the which one? White blood cells. It is going to happen agranulocytosis. Okay, fine. Next question. A nurse notes that a client with schizophrenia and receiving on antipsychotic medication is having uncontrolled movement of the lips and tongue. The nurse determines the client is experience. What was experience? So that nurse note the client with schizophrenia and receiving on antipsychotic medications. Uncontrollable movement of the lips and tongue. Okay. So nurse determined that client is experiencing what is that? A, neuroleptic malignant syndrome. B, dyskinesia. C, Parkinsonism. D, hypertensive crisis. That is movement of uncontrolled movement of the lips and tongue. So the correct answer is what is that? Tardive dyskinesia. Why? It is characterized by what they are saying, uncontrollable involuntary movement of the body and extremities. Okay, this is called it as tardive dyskinesia. Okay, next question. A nurse is giving instruction to a client taking risperidone. The nurse advises the client to which of the following? So the drug is risperidone. So which should be follow? A, discontinue medication when the symptoms went away. B, take it on empty stomach. C, change position slowly. D, get a daily source of sunlight. So nurse advise the client what will be? Change position slowly. Why means if you are taking risperidone, you will be getting the orthostatic hypotension. So for that reason, the nurse should tell the patient, please try to change your position whenever you are sleeping or walking, whatever it is, that you have to be tell. Next question. Which of the following symptom is classified as a mild lithium toxicity? A, apathy and lethargy. B, tinnitus and blurred vision. C, muscle fasciculation and oliguria. D, confusion and ataxia. So, what is that? Mild lithium toxicity. So, what will be the correct answer? Most probably that apathy and lethargy is a correct answer. Okay. along with some tremors and muscle weakness will be there. So that is a mild lithium toxicity. Okay, got it? Now we can move on to another question. A nurse is giving instruction to a client receiving lithium citrate. The nurse tell the client to do which of the following to prevent lithium toxicity. So that already they are taking lithium. So A, restrict salt intake in the diet. B, instruct the client to change position slowly. And C, avoid becoming dehydrated during exercise. D, limit fluid intake. So actually what will happen that usually what is the answer will be avoid becoming dehydrated during exercise, because if you are taking continuously for long time lithium, so lithium toxicity will be there. So what will happen, reduced drug excretion, that means the drug is not able to excrete it properly, so you will get dehydration, worsening the renal function, concurrent infections and drug interaction. So that is why what they are saying, avoid becoming dehydrated during exercise. Even other things also we can say, but most probably the correct answer is avoid becoming dehydrated during exercise. Next question. Macro, sorry, Margot approached nurse Trisha asking for advice on how to deal with his alcohol addiction. Nurse Trisha should tell the client that only effective treatment for alcoholism is, what is that? A. Aversion therapy. B. Psychotherapy. C. Alcoholic anamnesis. And D. Total abstinence. We can do aversion therapy and psychoalcoholism, everything. But what is the correct answers will be there? What is that? Total abstinence. Suppose if you are not doing total abstinence, that means fully you have to be stopped. Chronic disease, if it has happened, what will happen there? It will affect the whole liver. The liver is going to be fully damaged. Okay. So first we have to aversion therapy, psychotherapy, everything we can do, but at last total abstinence you should do. So that will be the correct answer for the, what is that? Alcohol addiction. Okay, fine. Next question. Nurse Hazel is caring for a male client who experiences false sensory perception with no basis in reality. So this perception is known as, what is that? False perception they are saying. Okay, A, neologism, and B, loose association, and C, delusion, and D, hallucination. So what will be the correct answer? So that is false sensory perception. So that will be the correct answer, hallucination, because the person is, what is that, caring for my false sensory perception with no basis of reality. Most probably it was happen in schizophrenic patients. So that will be the correct answer is hallucinations. Thank you for watching. If you want to more videos, kindly watch Jailfish Nursing channel. Thank you once again.